Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Obsessive Compulsive Disorder, OCD. You have heard of it. You've probably heard people say they have a degree of it. It can be something so debilitating to a person's life and really change how they live. So we're talking with Dr. Rebecca Denning, psychologist, about how we can identify this and how we can deal with it. Thanks for being here.
Thank you for having me.
It is a great topic and some that people talk about all of the time, but what are the official symptoms of OCD?
Sure. With OCD, you can have obsessions or compulsions. So obsessions are intrusive, unwanted thoughts, and then compulsions are behaviors, and the function of the behavior is often to reduce some of that distress that the thought creates. And I think often when people think about OCD, they think about things they've seen on TV. So they think about cleaning or organizing, this sort of thing. But OCD can show up in a wide variety of ways, from just mental rituals to scrupulosity or religious-based intrusive thoughts and then behaviors associated with that. Sometimes it's about avoidance, like avoiding doing certain things in order to try to avoid an outcome or neutralize a distressing thought. But for clinical OCD, we're evaluating those intrusive thoughts and those behaviors, as well as the impact that it has on someone's life, the time it takes, the degree of control they have over it, how it affects getting through everyday routines.
Yeah, it can really change your life. Let's talk about that. If you have to do 15 steps before you're ready to start your day, it can make a difference, especially when those steps don't happen. And sometimes things don't go as planned.
Right, absolutely. So in that case, if the ritual is interrupted, someone might feel like they have to start again, and it can become time-consuming and also very distressing. And it can show up in all settings. So for example, sometimes with kids, it shows up in the classroom, and it might look to others like they're doing something strange or something disruptive, and you might even think they're acting out. But if it's driven by OCD, then we need to respond to it a little bit differently in order to help that person and actually target the behavior.
So that brings me to the misconceptions. A lot of people want to throw out a general statement, oh, it's just my OCD, but that's really, there's specific clinical guidelines that qualify it.
Yeah, and it is absolutely true that people can be rigid about certain things. They can be very particular about certain things. When we're talking about clinical OCD, we really are talking about something that is incredibly impactful and can be, as you said, debilitating for the patient as well as for their family and friends. A lot of times OCD starts to involve family and friends, whether it's rules that OCD gives us for them or things we need them to do in order to help with neutralizing that distress. And so it's something that is so impactful and can be so debilitating.
Are there triggers that can kind of bring it on, or is it something that you're born with and you just kind of develop early on and can stay with it?
There are definitely vulnerabilities that people have. OCD and anxiety disorders can certainly be more common in some families than in others. And sometimes there are situations that might exacerbate it. But the good news is that we do have good treatments for it. Medication management can be a really important piece, and then the therapy that we use, exposure response prevention, has good outcomes too. So we want to work together with you to get those things in place as early as possible.
And tell me real briefly about that exposure therapy that you're talking about.
Sure. And so what we're trying to do is to identify all the places that OCD shows up for you, and then we work on being in those situations and tolerating that distress without doing the compulsion that would give us that relief. And so it's hard. It's hard for the person doing this. It's hard for the people that love them and see them having to tolerate that intense distress. But ultimately, that's the way that we're going to work through this. And it's not as simple as, well, just don't do that, even though that seems like good recommendations. We really do need to have some skills to be able to tolerate that and push through that, because the intensity can be so extreme.
So some role play to work around it and find a way through it.
Yeah, and sometimes creativity can be something that is helpful when we're doing this, to try to make it a little bit a little bit more bearable.
Yeah. Okay. Some great information about obsessive compulsive disorder, what it really is.
Absolutely.
Dr. Denning, we so appreciate your time today. Thank
Thank you.
Thanks for checking in on Monday Health Minutes.